Hi, my name is Lily Ethington. I'm a student at the University of Michigan Flint, and my poster is on the increased availability of remote healthcare appointments and telehealth technological device loaning programs as strategies for improving telehealth opinion by adolescents with different household incomes. And for background, telehealth is defined as the delivery of health-related services through the means of digital communication. It can be used in many different medical settings, and it lowers the cost of medical care in the U.S. A variety of different technologies can be used to support telehealth, including phone calls, video calls, health apps, emails, and more, and specifically adolescents shared that telehealth is user-friendly and saves time. And so the aim of this study is to recognize adolescent opinions on options to improve telehealth with the results separated by family income of the participant. And I'm going to zoom into the methodology here. So for recruitment, we recruited teens aged 14 to 17 living only in Genesee County, Michigan. We interviewed participants no matter their telehealth experience, and those of Latinx and African American descent and those living in low-income households were intentionally recruited. For consent, parents and guardians completed consent forms. Parents and guardians completed consent forms and sociodemographic surveys. These were completed before the interviews took place, and adolescents completed assent forms before recording interviews. So, for the interview portion, participants were asked to provide suggestions on how to improve telehealth. Other questions were centered around how healthcare providers can work to increase telehealth access and refine experiences. And at the end of each interview, participants received a $100 gift card for participating in the study. And for our results, as we can see in Figure 1, around 46%, 37 out of 81 participants, were covered by Medicaid health insurance in the past year. And Figure 2 shows around 28%, 23 out of 81 participants, were part of households with an income of less than $40,000 a year. And we found that participants from lower income households were more likely to suggest that health providers start device loaning programs than participants from higher income households. And participants from lower income households were more likely to suggest ways to increase telehealth access, while those from higher income households were more likely to suggest ways to improve the telehealth experience, like appointment structures. And to conclude, adolescents provided innovative and useful suggestions towards the advancement of telehealth, and in the future, studies should be conducted where we actually implement the device loaning programs and refining the suggestions about refining telehealth experience. And that is all I have. Thank you for listening.